Good afternoon, everyone. I'm Kelsey Timby, the director of the Veterinary program at the Focus Ultrasound Foundation. Our next session will be a panel discussion on veterinary applications of Focus Ultrasound. Our moderator today is Dr. Nick DeVrissis of the Virginia Maryland College of Veterinary Medicine, and he will be introducing our panelists. Thank you.
Thank you, Kelsey, and thanks everybody and the foundation for inviting us here. I'm Nick DeVrissis. I'm a medical oncologist for dogs and cats working at Virginia Tech. And I will spend the next few minutes presenting the panel. Some of them are here, some of them through Zoom. So my work has to do with, started with high-intensity focus ultrasound, the thermal version. We tried to model it in the dog. Our initial studies tried to show feasibility, safety, and targetability of tumors, soft tissue tumors in the dog. The lowest hanging fruit when you're trying to treat dogs are soft tissue sarcomas. So we initiated the first feasibility study using MR-based HIFU to try to find out which ones can we feasibly target. And afterwards, we moved during the pandemic, finally completed the pilot study on using thermal HIFU on ablating soft tissue sarcomas, evaluating how feasible that is with an ultrasound, real-time based unit, and try to develop therapeutic devices in parallel that we can use in dogs and provide some feedback to the biomedical scientists and engineers behind the devices and understand the tumor microenvironment changes that actually can take place after the treatment. Ultimately, in veterinary medicine and our group we're trying to help animals, but we're also trying to understand the biology behind so we can translate it into human medicine. So basically, in our study, we showed that that using a commercial available clinical thermal HIFU unit developed for people, we're able to target effectively and safely soft tissue sarcomas in animals, and we're able to demonstrate that while we ablate the tumor, within the tumor microenvironment, we can induce a few days later an immune response that in this particular tumor is characterized by infiltrating macrophages surrounding the ablated area. The next Virginia Tech person is Dr. Sana Klein, who should be on Zoom for this meeting, and her work has been focused on histotripsy, mechanical, non-thermal ultrasound-based tumor ablation. Initially studied dogs diagnosed with soft tissue sarcomas using a treat and resect approach, where they treated part of the tumor, did a treatment planning based on CT, during the treatment monitored the treatment real time with ultrasound, and then resected the tumor and interrogated the tumor microenvironment for changes, and pretty much demonstrated what we were expecting with our engineering colleagues, that this is histotripsy could be safely delivered, develop the parameters of how to safely deliver the treatment, and demonstrated proof of principle shifts on the tumor microenvironment towards a pro-immunogenic phenotype. And currently we have finished a small pilot study using histotripsy versus thermal HIFU on cats with a very aggressive type of soft tissue sarcoma that typically is induced by vaccination and other injections. Then Dr. Tui, sitting next to me, she's our surgical oncologist at Tech, and she has a strong interest on primary bone cancer in dogs. Primarily it's osteosarcoma, which is a very important disease because while it's very common in dogs, it's extremely rare in people, but it affects teenagers, same biologic behavior. And so she's studying histotripsy as a way to ablate the primary tumor, but also does a lot of work on translating the immunologic reactions to the ablation through mechanistic models that she develops in rodents. Then through Zoom, Dr. Maxwell is joining us, and he's actually working on kidney stones, not cancer specifically. So using histotrypsy as a non-invasive way to breaking down kidney stones, specifically stones located in the ureters of cats, which is a common and very life-threatening problem, acute life-threatening problem that cats face. And I don't need to explain that people face the same problem too, and it's excruciatingly painful. And from the Ranzan lab at Oklahoma State, they're working using thermal HIFU and recently boiling histotrypsy for treatment of virus tumors in the dog. So they started their work with oral tumors and showed gross regression during multiple treatments, and they were able to help the animals feel better and actually live longer, having good endpoint data, both imaging and clinical. And then moving into boiling histotrypsy, comparing two methodologies and demonstrating that heat ablation versus boiling histotrypsy may result in different systemic immune responses that can be actually followed through time. And with that, we can probably initiate the discussion. I will ask the people on Zoom to perhaps start introducing themselves. So, Adam?
Sure, thank you for the introduction. I'm Adam Maxwell from the University of Washington. I'm a biomedical engineer, and I've been conducting research in focused ultrasound for nearly 20 years. Most of my work is centered around mechanical therapies such as histotrypsy and a technique we call burst wave lithotripsy, which is using focused ultrasound to disintegrate kidney stones. This technology recently completed 2 human feasibility trials led by my colleague Mike Bailey, and we're interested in applying this, as shown in the slides, to cats that have obstructing ureteroliths. We've redesigned a human burst wave lithotripsy system to adjust it to the smaller anatomy of a cat, and we've demonstrated in benchtop models that it's able to fragment natural stones taken from these surgeries in cats. And so we found that we've been able to fragment a large majority of them, and so we're now moving forward with recruiting to treat the first cases at the University of Minnesota Veterinary Medical Center. And so we feel this could be very impactful, and I'm excited to be part of the panel today to discuss the overall impact that focused ultrasound can have in the veterinary space.
Thank you, Adam. Ramasari?
Yeah, thank you. I am Ramaswamy Paul Murugan, professor in the Department of Radiology at Stanford University. And we are working on microRNA therapeutics. We use microRNA as a kind of therapeutic agent to reprogram cancer cells to presensitize them to follow up chemotherapy. And we completed the phase 1 trial where we showed that the use of ultrasound microbubble mediated delivery can kind of deliver sufficient amount of microRNA to hepatocellular carcinoma in canine liver, dog liver, so that we can use that for the follow-up chemotherapy. Currently, we completed the phase 1 trial and published the results in Advanced Therapeutics, and it is showing very high level of delivery to the tumor, as well as it is also able to recruit a lot of immune cells, therapeutic T cells, so that they are enhancing the therapeutic outcome. Now we are working on the phase 2 trial where we are treating the dog canine cancer, hepatocellular carcinoma, by using the same microRNA panel and follow-up chemotherapy using sorafenib. So that we are treating first, then we are giving the sorafenib for 2 weeks, and we are looking for how much the tumor shrinkage, as well as the change in the apoptosis, as well as the immune cell profiling. We are currently working on these. Both these projects were funded by Focused Ultrasound Foundation. Yeah, I'm helpful to that. I'm ready to discuss any results based on this. Thank you.
Thank you. And last but not least, for the Zoom, Sana.
Hi, thank you for that introduction. My name is Shauna Klain. I'm a veterinary medical oncologist at Virginia Tech. I came into the picture in 2019 when I was introduced to Dr. Vlasavljevic. And this is coming on the heels of the HIFU trial in dogs with soft tissue sarcoma. And he's convinced us that histotripsy is better than HIFU. Full believer, but we did complete a pilot trial in dogs with soft tissue sarcoma that was recently published. And the interesting part for me is the immunomodulatory capacity of focused ultrasound, specifically histotripsy. And then you may have all seen the paper, the Teresa trial that was published last month as well, where 2 patients demonstrated a potentially abscopal response. So this, to me, is the most fascinating aspect of it. And so in our work, we were looking at the tumor microenvironment in dogs with soft tissue sarcoma. There were 79 genes that were upregulated associated with the immune response, specifically around immune cell migration, as well as wound healing response. And then on IHC, there was an infiltration of macrophages into the tumor. And we followed this up with a trial in cats. We had 6 cats total in treat and resect. And in that study as well, there was an infiltration of macrophages into the tumor microenvironment. So this is very interesting to me. We also have looked at checkpoint molecules in the tumor microenvironment in the dogs following histotripsy, and it does look like there is a decrease in PD-L1 and as well as PD-1, both gene expression as well as on IHC. So I would love to talk more about the immunomodulatory capacity of focused ultrasound and hear any of your thoughts on that as well. Thank you.
Thank you. And speaking about the immune system, Dr. Tui.
Thank you. Thank you to the Focus Ultrasound Foundation for your kind invitation to be on this panel. I'm really excited to be here. As Dr. De Vries has pointed out, I'm a veterinary surgical oncologist and also an immunologist at Virginia Tech. And my work focuses on osteosarcoma and the strong similarities molecularly, biologically between canine osteosarcoma makes the canine model of spontaneously occurring osteosarcoma a very strong comparative oncology model. So my interest in using histotripsy for treating osteosarcoma has 2 primary goals. One is to treat the primary tumor and also to treat metastatic disease. The mechanism by which we can ablate osteosarcoma using histotripsy is very attractive to me because it offers a non-invasive limb salvage option. So with the advent of advances in surgical techniques for limb salvage, we've managed to be able to remove the primary tumor very well, but limb salvage surgery or amputation surgery still comes associated with potential complications and morbidities, for example, the need for repeat surgery. So a non-invasive limb salvage option is very attractive. And also the immune modulatory responses that could be potentially seen in patients after histotripsy treatment of osteosarcoma is also a very attractive characteristic of histotripsy that I would like to investigate further. Our group has started work using preclinical in vitro models as well as murine models of osteosarcoma, and also the canine model of spontaneously occurring osteosarcoma with client-owned dogs. So these are dogs not purpose-bred, they belong to owners, and they come to the clinic for clinical trials, and our early studies have shown that histotripsy can be delivered safely and effectively to dogs in vivo with osteosarcoma, appendicular osteosarcoma. And also we have suggestion of upregulation of the immunomodulatory response within the tumor microenvironment and also within peripheral circulating immune cells. So thank you for your invitation again to be on this panel, and I'm very excited to discuss this research with you and translation of veterinary research into human oncology research as well. Thank you.
Finally, Assis.
Thank you all for attending this PM, and also many thanks to Kelsey and the First Foundation for inviting me to join this panel. I'm a veterinary scientist, and I have interest in leveraging the immunomodulatory properties of HIFU to treat cancers by activating the anti-tumor immune system. And we do so using a drug plus device concept where the drug for us happens to be a chemotherapeutic, an immunoadjuvant, or a nanoparticle. And when we combine those with HIFU to improve treatment of not only the tumor we are treating, but also of the tumor that we are not treating, which in the field of immunology or immuno-oncology is called as abscopal effect. So the goal is to treat locally a disease that is systemic in nature. And we have used that concept to perform veterinary clinical trials. And the tumor types that we are trying to study includes melanoma that has a pathophysiology which is very similar to human melanoma. And we're also focusing on sarcomas, again, because they have some resemblance to the pediatric sarcomas that we see in the patient. We are not very selective when it comes to HIFU parameters because we feel that a lot needs to be learned, not just at the bench level, but to use the wonderful opportunities that veterinary patients provide to us in terms of understanding how different HIFU parameters work in a clinical setting. When a vet patient presents themselves with a particular type of tumor, not just the tumor type, but even the physiological features of those patients are very similar to humans. So some may have diabetes, some may be immunocompromised, and doing HIFU in those cases does teach us a lot as to how some of those treatments may look like eventually in the humans under the broad umbrella of One Health. So we have tried histotripsy, we have tried thermal ablation, and we have had some interesting results in terms of HIFU's ability to not only reprogram the tumor microenvironments of those patients at the treated site, but also at the systemic level in terms of the cytokine profiles and the immune cell activation. So I'm very excited to be here today and look forward to discussing more in this panel.
Thank you. I would like to pose a first question to the panel, and whoever wants can go first. And it's relatively clear how developing a new treatment modality, whether it is for cancer or non-cancerous disease, dissolving stones, can help the animals themselves. But can you comment on how working with animals with this new technology can help advance the technology, but also help people?
As I said, vet patients share the same family life as humans. So many things that are going in them pathophysiologically is not any different than what we may see in a human patient. There are some tumor types that have a similar clinical presentation as humans. We discussed about melanoma, sarcoma, some other tumor types that are very similar to humans. So if we were to do some kind of study in a vet patient, definitely you have an opportunity to take it to the humans, either in sequence or in parallel. The other area where veterinary patients can have a role is when you're dealing with rodents. Many times when these devices are being developed commercially, the footprint of a commercial device is not tailor-made for a smaller animal. It's more for mid-size to a bigger patient. And again, if we were to study those devices to treat, for example, a deep-seated tumor, where you have to learn a lot on how the device may function in a clinical situation. Again, doing those in animals can allow us to learn at a much faster pace how it may look like in an actual human patient. So I don't think that veterinary community or veterinarians as such should have an intent of doing this treatment only to advance human medicine. I think the goal can be bilateral, where we are doing things to advance veterinary medicine while also helping the human clinicians understand the value of those trials, and vice versa. What is exciting, whatever exciting that is happening in the human world can be brought back to the vet patients and make difference that way.
Any additional comments?
I can give one example from our own research. In particular, we're very interested in the long term in not only treating adult patients with stones, but treating pediatric stone disease, which is becoming a larger and more prevalent problem, especially within the last couple of decades. And to conduct a pediatric clinical trial, you not only need data in adult humans with the new technology, but you also need some additional data in how the changes to a system are going to affect, say, the smaller anatomy of a child versus an adult. And so we're finding in part that the data that we collect in our veterinary trials is going to be directly applicable really to understanding how scaling of our technology is going to potentially affect the smaller anatomy of children if we were to carry out a clinical trial in the future, and that's a major goal of ours.
And I think that also, unfortunately, even though we would love for all our pets to be with us forever, they do have a shorter expected lifespan than people do. And so assessment of treatment outcomes, whether it's devices or whether it's therapeutic treatments, we can assess those outcomes a lot quicker than we can in a human clinical trial, just because of the shorter expected lifespan, at least in my experiences with oncology research, where we may have, say, for example, in dogs with osteosarcoma, they may have an expected lifespan of 10 to 12 months with definitive treatment versus a person whom we hope would have at least a 5-year or 10-year expected survival or more. So I think that's also another advantage.
Thank you. The next question that I have for the panel, and I will ask for the Zoom panel to go first, is can you each pick one major hurdle in the development of focus ultrasound as a therapeutic modality in veterinary medicine?
I can go first on that one. One of the major limitations, but also one of the benefits of employing these technologies in our veterinary patients is that the tumors, as they present clinically, are incredibly similar to the human disease, and the heterogeneity of the subtypes of sarcomas, as well as intratumoral heterogeneity, but also tumor size. And so we can have tumors that are as large as 20 centimeters on a dog, and that's also seen in humans. The downside is that where we are right now with the technology is the time that it takes to treat a large volume of tumor. So for a 3 centimeter diameter ablation area, it could be anesthetic time of around an hour. And so what we really need is rapid, large volume ablation technology.
Ramasamy or Adam, who wants to go?
Yeah, I agree with the other sector, because the genetic makeup of a dog is also much closer to human. The reason actually we have noticed when we selected microRNA as our therapeutics, we noticed that a matured microRNA sequence is exactly similar to human, even though the primary transcript is completely different. And so that we can exactly translate whatever be the outcome we receive from doing the study in canine model, exactly we can translate into human clinical, so that it is like a kind of mutually benefited each other, so that we can take the results straight away into human clinical trials. And the second, I also noticed that the tumor size is very big actually. When we want to treat a 2 by 2 centimeter tumor, it takes nearly 30 minutes. So that, but we have noticed like a kind of tumors are like a several centimeter in diameter. So that it is quite difficult by using the current ultrasound system. Actually, the entire area, you cannot like a kind of anesthetize the animal for quite a long time. So that we need to move the technology forward, where we should have like a kind of ultrasound system that is like a covering the entire tumor, like a 3D ultrasound or something which is able to deliver much faster rather than like a current strategy. That is my goal actually for the future. We are discussing with other ultrasound engineers and how to proceed with this.
I'll add one challenge that I can see, particularly in cases with dogs, is that there is a lot of heterogeneity in the anatomy compared to humans. And so although perhaps treating superficial tumors will, the design constraints are more limited, treating across the spectrum of anatomic presentations of animals is very hard to design for, a single system. And so it's possible that there's going to be a kind of a number of components that need to be integrated into one system to be able to, treat at the large end of the size range and the small end of the size range as well, especially for like deep tumors or abdominal applications.
Yeah, I agree actually, because if the depth when you go in deep, actually the tumors are not like a kind of exactly uniform size or uniform shape actually, then you need to adjust your system in such a way that they are like a kind of delivering energy straight away to the tumor, not killing the normal liver tissues. Yeah, I agree. Yeah.
Thank you. Can I modify the question to the two present panelists based on a question from the audience? So could you comment on the biggest hurdle that you foresee translating your research from, should it be successful in animals, into human clinical trials? So the hurdle of translation from veterinary medicine to people.
I think we may have to define the hurdle part. So if, it depends on the kind of indication that we are trying to treat. I can tell you some broad differences between how a veterinarian looks at a device versus how a human oncologist may look at it. In the vet world, cost is a factor. So if we were to develop an MR HIFU system that is for a vet patient, that might be a little bit challenging just based on the technical needs and the cost of it versus how it may look like in a human. But I think if the indications were to be chosen appropriately, the hurdles can be mitigated to some extent. For example, if we were thinking that almost every disease that looks similar in human as vet patients should be translatable, I don't think that would create many hurdles. But if the intent was we focus on some case types, for example, disease types that are similar in its pathophysiological features, then I would think that the hurdles may be a little bit lesser.
Yeah, I think another hurdle which is not insurmountable but is currently present is in the realm of immune evaluations and being able to translate and have a robust data set that we can use to support human clinical trials. I think the limited availability of canine-specific reagents, for example, for immune analysis, and also the limited availability of, say, other therapies which may be more widely used in human oncological patients, for example, monoclonal antibodies. We don't have those reagents yet for the veterinary space, and so that could present as a hurdle for gathering the data that would be important to be able to translate what we find in veterinary research into human clinical trials. But again, not insurmountable. We have to find more of those reagents and antibodies.
Thank you, Joanne, and I would like to thank again all the panelists and all of you staying here after lunch, and above all, the foundation for organizing this. And take it away.